Sweating and underarm odor can make us very uncomfortable and self-conscious. From being aware of the way we smell to others, to those annoying sweat stains on our shirts and cute clothes. However, science and technology have once again found a way to help us with a permanent fix, sweat gland removal. Now this sounds scarier than it actually is. Remember that odor is caused when bacteria in our underarms mix with the sweat and the secretions from our sweat glands. Removing these sweat glands from the equation gives the bacteria nothing to react with, to cause odor, and also fixes our sweat stain problems. So how is this procedure done? Generally, your sweat glands can be removed in an office or clinical setting or in an operating theater, either by liposuction, curettage, laser surgery, or sympathectomy. Liposuction can be done in an office or clinical setting by a trained dermatologic surgeon. You will receive local anesthesia and the doctor will use a suction technique to remove the sweat glands from the underarm area. It is similar to how fat is removed, except that the glands will need to be cut from the rest of the tissue at the end of the procedure. Curettage can also be done in a clinical or office setting under local anesthesia. The doctor uses a special surgical instrument with a circular loop on the end to scrape out as many sweat glands as possible, or at the very least, to injure the sweat glands sufficiently so that they stop functioning. Laser surgery is also done in an office or clinical setting by a trained dermatologic surgeon. They will use special lasers to directly target the sweat glands, which causes them to disintegrate. Afterwards, the body will naturally drain the destroyed cells of the sweat glands, or your doctor may liposuction them out. Please keep in mind that dermatological associations of the world no longer recommend that doctors cut out the sweat glands. The cutting out of underarm tissue that contains these glands has been linked to scarring that can cause a range of motion problems for patients as the area heals. Finally, the last resort is a more invasive procedure called a sympathectomy. This is only used if the patient has no other choice. It is a very invasive and complicated procedure that needs to be done by a trained dermatologic surgeon. It involves damaging the nerves that control sweat gland activity from inside the chest cavity. You will need to be admitted to the hospital, and the surgery is done in an operating theater under general anesthesia, meaning that you are put completely to sleep. Now, a common question that we get is whether removing our armpit sweat glands is safe. And the answer to that is yes. The function of our sweat glands is to produce sweat, which helps to cool our bodies down. But because the sweat glands in our armpits are just a few, it won't hinder our body's cooling ability by very much. Additionally, you can also keep yourself cooler by wearing loose clothes, staying out of the sun, taking cooler showers, and staying hydrated. So what are the benefits of removing your underarm sweat glands? It is permanent, the results are immediate, and sweating and odor will disappear once your underarms have healed. On the other hand, like all procedures, there are also risks associated with sweat gland removal. There's a risk of infection. Like with all invasive techniques, you can potentially develop an infection during the healing process. You may also experience some side effects after the procedure, like redness, swelling, or pain, and there's a risk of overheating. Sweat glands help us to keep our temperature under control. However, overheating is only a concern if you remove too many of your sweat glands. Just removing your underarm glands should not significantly affect your body's ability to still cool itself down. So, who can get their sweat glands removed? Underarm sweat gland removal surgery is an option for anyone who has unsuccessfully tried other remedies for excessive sweating or underarm odor. However, if you are pregnant, if you plan to get pregnant anytime soon, or if you are breastfeeding, this procedure will not be a good idea for you. Therefore, make sure to let your doctor know about any of these circumstances. Who should do your underarm sweat gland removal procedure? Sweat gland removal can and should only be done by a trained, qualified, and certified dermatological surgeon or plastic surgeon. Remember to do your research about clinics, their experience, and any reviews that you can find to make sure that you are being treated by someone that knows what they are doing. Check the description below for the full article on sweat gland removal and other articles to help with underarm odor and sweating. This brings us to the end of today's video. For more videos like this and other skincare related videos, be sure to subscribe and hit that notification